Hey guys, it's Dr. Adam Nally coming to you live here on the Facebook Live. I was trying to go live on YouTube, and my camera would not link into the RMP feed, so I had to switch over here. Hopefully, some of you followed me over from the other site. It is what time is it? It's 7:11. I'm supposed to come on at 7. I'm going to try to do nightly brief videos. I'm going to try to roll them through my YouTube page. Hello, Ann. How are you? But the challenge is I may or may not get them on that way. We'll see. Website has some improvements to it, and I was hoping to have a live that was available on my Dark Muscle site. But for right now, we'll just do it YouTube. We'll do Facebook Live. So hopefully that helps. And hopefully people are able to roll over from the group that was there before. For those of you that don't know me, my name is Dr. Adam Nally. I'm a board-certified family physician and a board-certified obesity medicine specialist. I've been in practice about 20 years in the northwest corner of the Phoenix Valley. I do full-spectrum family medicine with a heavy emphasis on ketogenic lifestyles, intermittent fasting, that sort of thing. Hello, Dave. How are you? Gwen and Vicky and Mark, it's good to see you guys joining in. Thanks for joining us here. I appreciate it. Hello, Luke and Jeannie. It's fantastic. I appreciate you guys joining in. I thought this evening I would just kind of give a brief update on the coronavirus and what we're seeing, because my patient population is fairly heavily over 65, and a lot of them are susceptible to this particular virus and have a lot of worries about it. So I wanted to touch base with you guys this evening and answer any questions you might have. I know there's a lot of people that have a bunch of questions. Hello, Berkeley. How are you? Hello, Linda, Carolyn. So let me just dive right in and tell you kind of where we're at right now. Many of you have probably seen the statistics. I'm in Arizona, and we have about 63 cases of coronavirus that popped up today. As of today, it's at 63. That's a jump from a couple days ago at 30. I know across the country there's a number of them. They have almost 8,000 in New York right now. So the numbers are increasing rapidly. I've had a number of people today ask me, is this really real? And unfortunately, it is really real. Yes, it's real. We are not seeing it yet. My worry is that we might if we're not careful in regards to quarantining and hand washing and social distancing and all those kind of things. So what exactly is this virus, and how is it different than the flu? A lot of people have asked me that. The nuts and bolts are to this. If you get the flu and you're older, you might get bronchitis, you might get a pneumonia on one side. This particular virus hits hard, hits fast. Number one, it hits within, the average time is within 5 days you have symptoms, and within 5 days of that you have a double pneumonia, and within a few days of that you have what's called a cytokine storm, which means your body's hormones that attempt to help you modulate your immune system become literally overwhelmed to where you cannot modulate it, and you end up going into what's called acute respiratory distress, which means that the lungs shut down with their ability to move oxygen, you fatigue, and the challenge is that a significant percentage of those patients, 20% will have severe symptoms, and anywhere between 1 to 3% of those patients will actually die if not treated appropriately. The concern is that just like in Italy, where they've only had 40,000 cases in the last month, they've literally surpassed China in deaths, going to almost, I think, 4,500 or close to 4,500 as of this evening. One article said they stopped counting bodies because they're having such problems. I know they've converted two, and now a third hospital. The complete hospital has been converted into coronavirus wards. There's been 13 doctors that died there already treating this, and so we don't see this with influenza. We have never seen this rapid of a change. We never see this overwhelming type disease, and as of right now, I think this morning or yesterday evening, a couple of the hospitals, one of the hospitals in New York, I was told, is using they run out of ventilators, so they're double venting, meaning they've actually put two patients on a single ventilator because they're out of ventilators. You can see my animals in the background. My dog is over here chewing on a bone, and you may see my cat wander by, and you may see my family walk by through the hall. So, but I just wanted to touch base. I'm going to try to do something brief each weekday around 7 p.m. my time, which is Mountain Standard Time. I know some of you have a different time with the time zone, but that's really where we're at. So what I wanted to talk about in regards to this is what's happening. Why is it a problem, and why am I so worried? I'm worried because those that are susceptible are those that have insulin resistance. They're those that have hypertension, diabetes, heart disease, history of stroke, prediabetes, and obesity. Those are all predisposing factors to severity and predisposing factors to death if you actually get this virus. So that's the big concern. That's 80 to 85% of the people that I see in the office have a greater susceptibility, and that bothers me greatly. So that's why I'm concerned, and that's why I think this is real. And I've been testing for the last 2 weeks with my patients as much as I can where we suspect it. We don't have the number of kits that we need to test as frequently as we'd like to test yet, but those are coming. I am reassured they will be. So let me just pop through here. So that's kind of the update. The challenge is this will double every 4 days if it's not controlled through social distancing and quarantine. So that's why you're seeing California quarantine. That's why if you look at the news today and you see noon in downtown New York, it was literally desolate. The New Yorkers are starting to see that this is real, and it's starting to become a real big issue. So I want you to be aware of that. Let's see. I've been hiding, and yes, I have been hiding. The challenge as a solo physician, and let me kind of give you some background. With me, I'm a solo practitioner. I have a PA in the office, and the ability to operate a solo office by yourself is getting harder and harder these days. It gets to where I have to see 30 to 35 patients a day myself, and the charting is enormous, and so I literally am working from about 7:30 in the morning until often 11:30 or 1 o'clock in the morning that night, taking care of charting, taking care of all the things that occur. So the challenge is the hours. It's getting harder to be a solo doc and do what I do, and so it's been harder and harder to live stream and to participate in social media like I like to, other than in between patients when I put up silly memes, which is what really kind of keeps me sane. But I love my audience. I love those out there, and I want to make sure you guys get good information and education. So that's why I do what I do. And so I'm going to try to do brief ones every weekday at 7 p.m. I've decided that's my time. If I can roll them to YouTube, I'm going to do that. If not, I'll use Facebook Live until then. So that's kind of the story. Hello from Surprise Alec. All right, let me look at some questions here you guys may have. Let me back up a little further. So prevention. We know that getting adequate sleep is good. Social distancing is essential. Quarantine is essential. Now, we know there are some interesting studies that have come out showing that melatonin use around 10 milligrams at night may have a preventative effect. Again, may is the key word there. The study is small. As of today and last night, a study was released showing that a medication that we commonly use for malaria and for rheumatoid arthritis called Plaquenil or chloroquine. Chloroquine is one medicine. The other cousin to it is called Plaquenil. These medications have been shown to notably decrease the ability of the virus to damage and enter the lung and to replicate. To make it simple, it's very complex, and we still don't fully understand it. The FDA is right now being charged by the president to streamline this particular drug to be looked at and approved for use with coronavirus. As one of its indications. Right now it's not indicated for that, and so those that have used it are either using it experimentally or off-label. A physician can use a drug off-label, but when you use a drug off-label, it means that you have to warn the patient that it wasn't designed for this particular issue, and there are risks and side effects that can arise. Plaquenil does have risks and side effects, and they are fairly significant. So this is one of those drugs that is being looked at for that specifically, and that's what the big press conference was this morning with President Trump. There are a couple other medications, a couple antivirals, including azithromycin, which is actually an antibacterial, but does have some effect on suppression of viruses that have been used in conjunction with this. And the small studies of about 25 to 30 patients showed some great promise as of the publication that was there. And I spent a lot of the early morning this morning reading those publications, trying to understand that, because that's something that may be essential for us as we come closer. I'm very hopeful that could be both a prevention for those that have been diagnosed positive and or a treatment for those that are severely ill. So that's a lot of information I just gave you really fast. Let me answer some questions here. So I'm going to, and I know there's hundreds of questions that have rolled in. I'm going to try to see if I can answer these as best as I can. All right. Hello to everyone. If I didn't acknowledge you, please recognize I do see you. I'm just going to try to catch some of the questions as I roll through this. Arizona is way behind in testing. We are, Catherine, yes, and that's because the labs had a limited number of test kits. I had all of 5 2 weeks ago. We ordered some and they sent us 5 more, and so I've been able to test about 8 patients up through the last 2 weeks myself. Thankfully, all of them have been negative up to this point that we're waiting on, so that's actually really, really, really positive. But these test kits are still coming. They are coming, and my hope is that there'll be much greater availability next week. Let's see. Work for Social Security. We're all sent to work from home today. I understand. I agree with that wherever you possibly can. Let's see here. Great information. It's a scary time. It is a scary time, Stephanie, but don't let fear overwhelm you. I think that one of the challenges is that the sensation of the media has overwhelmed a lot of people. If you look at it statistically, 80 to 82% of people who get this virus probably won't have a problem other than feeling like they got the flu and a bad cold together. Other than the other 18% may very well be very severe and have risk for mortality or death. I'm going to be frank about that, and that's why our president and our Congress and the country has stepped up suddenly and created this need to quarantine. From a perspective of a physician who deals with this stuff and reads it every day, I think it's essential. Doing the math, if 20% get the virus and 1% of those die, then it's a 0.2. The rate can be, and Mike, thank you for clarifying, because I gave you a number that wasn't, I gave a number for the entire population, not for the 20%. Of the 20% that get the virus, let me say, of the 100% of people that get the virus, anywhere between 1 to 3.5%, as of some statistics today, of that 100 may die. Now, if you take that, that's of that 20%. If you break that down number-wise, I'm not going to be able to do the math in my head that quickly. If you had 100 people get sick, 20 of them are severe, 3 of those may die, and that's the number. 3 divided by 20, whatever that is statistically, or mathematically-wise. And I'm not going to be able to do that in my head alive here. So if somebody wants to do the math and pull out your calculator, do that for me. Whatever that is, 3 divided by 20. Anyway, I'm in California. Did not go out and do a rock today. Okay, let's see. Been sick for 10 days, and I don't know if I have. It looks like you get in for testing. So I have a lot of patients that are coming into me who have a stuffy nose and sore throat that started out. That's probably rhinovirus. That's probably para-influenza virus. That's what I'm seeing a lot of. I had a few patients with actual influenza. Those cases are not horrible. This particular virus starts out with a high fever, over 100 to 101, a dry cough with no nasal symptoms, and severe body aches. Those are the first 3 things that start. So if you're started differently, the likelihood is it's probably not this particular virus, and that's what I've been reassuring a lot of people with until we have more testing ability to screen everybody that wants to be screened. As a hospital employee, how do we protect ourselves? You protect yourselves by wearing gloves, distancing yourself, cleaning your hands, don't touch your face when you're in there, when you're in the hospital, and if your hospital is providing you any kind of mask, use it. And if they want you to keep your mask, that's the key. I know that masks are coming in. I know they're making more of those for those hospital workers that are out there. When are we contagious? Only with high fever, before and after. We know that contagiousness occurs when you're symptomatic, but there are some reports that people can spread this prior to having symptoms. So that's the part that's still slightly unknown, and so that's why we're being so cautious with this. What do I think of the use of hydrochloroquine and azithromycin? I'm really excited about it, Millie. That's one of the reasons I wanted to get on here and do an update, is because it's a small study and it's promising, and hopefully it's going to be a great treatment approach if possible. Thank you, Jonathan, for the compliment. Let's see. You enjoy the memes, says Mike. I enjoy making them and stealing them from others who have great memes, because there are some great people that do those. Let's see. What are my thoughts on NAC taken prophylactically to boost glutathione? Brandon, anything that boosts your immunity is probably great, but there's no data with this particularly, with this virus to say yay or nay on that, so I can't really comment on that part of it. Do I think a mask is going to help to stop spreading? Well, let me put it this way. Anyone who comes to my office because I am out of the N95 masks, what we do know is that if you put a mask on the person who has it, and you're wearing a mask yourself, it's the droplet that occurs when they breathe out. It's that droplet component when they cough, when they breathe out, when they exhale, that's the problem. So if they're wearing a mask and you're wearing eye protection and a mask, then you're much safer. Does that completely stop air from moving around? No, but you've dramatically decreased your risk there. So it's not so much that you're wearing a mask, it's that the person who's sick is wearing a mask, and that's the key. So when patients come into my office, they're taken right back into the exam room, so they're not sitting in the waiting room. In fact, if we know they're coming in, we've actually taken them through a back door. They go into the exam room. A mask is put on them as they walk through our door. All of us put on masks and gloves and protection, and that's how we're treating it. Hello from Mississippi. Let's see. What are your thoughts on... Oh, I already read that one. Let's see. First time catching live. Hello, Sherry. How are you? Let's see. Jonathan says, I've been sick for about 10 days. Any way to get testing at home? As of yet, Jonathan, there are not enough tests to test people at home yet, but I'm being reassured that those are coming through the 2 labs that I've talked with, that there will be ample lab testing and availability of testing sites in that regard. Let's see. I feel like I'm in the newest episode of The Twilight Zone. It kind of feels like that, doesn't it, Mark? A little bit feels that way. Repeat what you said about the cytokine storm. So Karen, tumor necrosis factor alpha, interleukin 1 and interleukin 6 are what are called cytokines and acute phase reactants. These are hormones that tell your body, hey, we have infection, we have inflammation, send out the troops. And the interesting thing is that those that died versus those that did not die with this virus, those that died, their cytokine levels were double those of those that healed and got better. Those that had double the cytokine value were dramatically higher. And what happens is you have this huge cytokine response, and we kind of think we understand why this virus stimulates that. But if you are already insulin resistant, you already have a disease that stimulates cytokines to be elevated, like CRP, interleukin 6, interleukin 1, tumor necrosis factor alpha, which is essentially insulin resistance. These are patients with high insulin. High insulin stimulates the fat cells to overproduce these cytokines. High insulin stimulates the liver to overproduce CRP. And I've seen this for 20 years in my practice, that when we bring the insulin levels back to normal, those cytokine levels drop again. So these are patients with these high stimulus of these hormones. Those are the patients that are most susceptible to having a poor outcome and responding to this particular virus, as we've seen in the studies from China and the information coming from Italy as of this point. I've had a number of people on the internet actually tell me I'm crazy because I think this is what it is. But if you look at the literature and you look at insulin resistance, and every patient I've ever seen in my office who is insulin resistant has an elevated tumor necrosis factor alpha, elevated interleukin 6, elevated CRPs, elevated interleukin 1. They're all elevated, and as soon as we fix that insulin load by cutting out their carbs and putting them on a ketogenic lifestyle, those loads drop. Now that's where I correlate the two of saying, hey, this is a challenge because those high cytokines already there. If you get this major infection, they actually double, and when those cytokines get higher, you have an opposite effect, and that's what we're starting to see, and that's what it's pointing to, this cytokine storm as we referred to it. I've been strict carnivore for 4 months, not in ketosis. Blood glucose staying in pre-diabetic range. Should I switch to keto instead to help lower insulin resistance? Well, Karen, if you're doing carnivore, more than likely you do it for 3 or 4 months, more than likely you have probably diminished that cytokine level fairly significantly. Does that mean you have to be in ketosis all the time? No. Does that mean it just means that you're seeing improvement in your overall blood sugar levels? You're seeing improvement in your fasting insulin levels. You're seeing improvement in your CRP levels. Those are the easiest things to test. Testing interleukin 6, tumor necrosis factor alpha, interleukin 1. These other cytokines are much more expensive and are usually not covered to be tested routinely. Hopefully that answers that question. 0.15. Yes, thank you, Mike. 3 divided by 20 is 0.15. So 15% of those 20. To go back to that previous comment. Thanks, I appreciate that. When I'm talking and going through this, I can never do math like that in my head. I have to pull out my calculator. Let's see. My 4 to burn with pulmonary valve stenosis. I'm not quite sure what that means. She has 20% regurgitation, blood valve, not shutting. Should I be concerned? So Mary, it's hard to... the challenge is if you have an underlying disease process that's causing you to be ill, lung disease, asthma, those kind of things, the potential for you to have elevated cytokines and increased risk is much higher. So those are patients that I would encourage to quarantine the very, very most. If you're over 65 and you have COPD, you're over 65 and you have asthma, I would be less likely to go to the store, and I'd send somebody else to go to the store and help you out if they can do that. I would be less likely to try to go into crowds. So that's really what we're looking for. the symptoms of having the doctor check you out is if there's a fever, dry cough, and body aches. You have everything but the high temperature, says Jonathan. Now, if you have symptoms of body aches and fever or cough, and you haven't been exposed to anyone with this known disease, then the likelihood the coronavirus is lower. May very well be like I said, rhinovirus or parainfluenza virus or even the flu. I've seen 6 cases of the flu in the last week. Influenza A and B. I've seen them both. So I know they're out there. And so what's happening is we're getting 3 or 4 different viral infections all rising at the same time this coronavirus is coming in. And it's freaking a lot of people out because they think just that cold is probably the coronavirus. And it could be any number of them. So that's why doctors are being selective right now, because we know based on your signs and symptoms that this may be one thing versus another. And because of the limitation in testing, we're limiting those testing to those that would be most likely positive to confirm it or not confirm it, if that makes sense. Either way, if you quarantine yourself, if you're short of breath, you can't breathe, you're having trouble breathing, go straight to the ER. That's what I tell my patients. Those are patients that we want to get checked out immediately. That's the sign that you really got to get to the ER. The other symptoms, my suggestion is call and talk to your doctor. This disease came at the height of allergy season, and it did. My son has allergies, and his allergies flared up, and so he was freaked out about, well, is this the coronavirus? Well, no, this is allergies, so something to be aware of. It took 3 months to get 100,000 cases. It took 12 days to get 200,000. By tomorrow, we may have 300,000. Very, very possible, Cheryl, and that's why we're quarantining, to try to prevent that rise so fast. The vitamins. What vitamins help the resistance? A good multivitamin is essential, providing your body what it needs if you're not getting it through your meals. There's no great one multivitamin that has been shown to cause any reduce risk, but I tell patients, take your vitamins. I designed my own vitamin. If you like my vitamin, great. Use mine. If you like your own, use yours. I designed mine because I like the one. I had certain things that I wanted out of my vitamin. That's why I designed it. But I'm not trying to sell vitamins. So that was not my intent tonight. Let's see. In Canada, so hard to realize this is real. Over 65, prone to bronchitis, working in the Canada office, anxiety is high, and it is. That is a challenge. Let's see. I already talked about that. Oh, you know what? Let's see here. Are pregnant women in danger? You know, if your wife is under 55 or 50, the likelihood that she's in danger is no. Pregnancy, your wife is creating antibodies for the baby, so that's fantastic. We know that children or youth under 20 are the least susceptible to this and have the least problems with this particular virus. So if you're pregnant, I would just tell you, quarantine yourself and don't go around large groups. Wash your hands. Try not to do what I just did and touch your face and rub your eyes. It's habitual, and we have to intentionally remember not to do that. Hashimoto's disease. If your Hashimoto's is controlled, you're not compromised. If your Hashimoto's is not controlled, then that does create some immunocompromise. Yes. Bill Gates told us about the coronavirus in 2015. Well, remember there are. The coronavirus, the original coronavirus, is the cause of the common cold. We've known about coronaviruses for years. MERS is a strain that was found in camels, that was transmissible to humans in the Middle East, and SARS was transmissible from bats. About in 2017 and 2000. Actually, I think it was 2003 and 2004, or I'm getting my numbers crossed. So we've had multiple different forms of coronavirus that have been around. And so, yes, we have known about it, and I know Bill Gates talked about it back then. Let's see here. I think the rapid rise of cases is now due to the fact that we are testing. I do, Mike. We're going to see a jump, which we expected to see because we're now testing more. We're going to see a jump in it because now people are able to get tested that need to be tested, and some that didn't think they had a problem are getting tested. All right, we have a 1-year-old and a 2-year-old in Ohio with the virus. There are Linda, are they in your family, or are they're just in Ohio there? Because kids can get it. We know that kids can get it, but the likelihood that it's going to be severe is very, very low. In fact, if you look at the statistics out of China and out of Italy right now, those that are younger don't have the severe complications. They just get the flu-like symptoms, if that makes sense. All right, I've been rambling on here for a while, and I'm going to 17 minutes to be exact. I had my right lower lung removed. Am I at higher risk? Sherry, if you're healthy and your white cell counts are normal, and you're not on immunosuppressive medications, then the risk is probably not so horrible, but I would still be cautious. Can intermittent fasting help? Absolutely. Intermittent fasting lowers the insulin and lowers the cytokines I talked about earlier, as does a ketogenic diet, as does a carnivorous diet. Started today and dropped the carbs to be as metabolic as healthy as possible. Absolutely, Crystal. Let's see here. I'm trying to see if I caught any other or missed any other comments or questions. You guys have great questions, and hopefully I'm giving you some answers and not creating fear. But the last thing I want to do is create fear for you in regards to what's happening. I want to create a sense of comfort in regards to understanding what's going on and how best to protect yourselves in that regard. Let's see. What vitamins do you suggest to protect against the virus? Well, there is no perfect vitamin, and I may have already answered that. There is no perfect vitamin that protects us against the virus. I recommend a good pharmaceutical grade vitamin that you can trust. I made one myself, and that's the one I use. If you've got one you trust and you like, use it. That's the key. Let's see here. Let me go back and see if there's any other questions that I missed in here. Great questions, guys. I think that's the case. All right, so that's the story. Again, those of you who are just joining in, my name is Dr. Adam Nally. I'm a board-certified family physician and a board-certified obesity medicine specialist. I practice in the northwest corner of Phoenix in a city called Surprise. I live in a city west of that called Waddell, and I've been in practice about 20 years. I do full-spectrum family medicine. I'm really geriatric medicine because most of my patients are over 65, and obesity medicine as well. I apply ketogenic lifestyles, carnivorous lifestyles, and intermittent fasting with those patients. We've reversed hundreds of cases of diabetes and probably thousands of cases of insulin resistance with these dietary approaches, and that's why I wrote a whole book about it called the Keto Cure. You can check me out on my website at darkmuscles.com. I have a whole YouTube page of videos that are either on that site, or go to youtube.com/drnally, and you can find my videos there. I'm on Facebook Live all the time as well, so check me out in those locations. If you have any other questions, please let me know. Hopefully this information was helpful for you and gives you some reassurance. Elderberry or elderflower have not been shown to be helpful in Jean Marie. They actually do suppress interleukin-6, and there was a study about it, but they actually showed that it was not helpful. So using elderberry has not been shown to be beneficial. Is using there's another immunomodulator that you can use to help stimulate an immune system, and it's slipping my mind all of a sudden. That one you can use for about 7 days, but I wouldn't use it longer than that. And elderberry is actually not been shown to be helpful, so I would not even waste my time with that one, because there was a couple studies that I looked at showing that it was effective with this particularly in that regard. Freaked, stressed out. Have you reviewed my labs yet? Mark Lance. Mark, I will go look at your labs as I hang up here. I have not reviewed your labs that I can remember yet, but I will go check. I got to go check and see. Let's see. I got here late, but some useful information. Great. We'll go back and watch the replay then for me, Mike. You are very welcome, Rose. Hopefully that helps. Let's see. Jessica said, good question. I've heard it's good for prevention, but not good if infected. Elderberry has been shown to have some improvement with some viruses, but not with this particular virus in the coronavirus. It was shown not to be effective, so I wouldn't even waste my time with it. Echinacea is the other one I was trying to think of. Echinacea does bump the immune system up for the first 7 days you take it, but it's worthless thereafter. So if you start to feel sick and you want to try Echinacea, you're welcome to try that as an adjunctive treatment. That it's not always been shown to be effective with everyone, but it does have some immune modulating effects that way. So my big suggestion is like a low carbohydrate diet, get adequate sleep, to try to decrease the stress. Make sure you do a little bit of exercise, a little bit of walking in the woods, not around other people, or take your family out and take them for a walk without running into a bunch of people, and wash your hands and scrub down surfaces with Clorox containing wipes or 60% alcohol containing wipes, because we know that the virus can live up to 72 hours on some surfaces, but alcohol wipes, like a simple alcohol wipe like this that we use on my stethoscope or things like that, or alcohol wipes you buy at the store kill the virus within 10 seconds. So that's why we're recommending clean your hands, wash your hands. Soap and water is always better than the silly hand sanitizers. If you have no soap and water, hand sanitizers is the next best thing, but hand sanitizers are oftentimes bacteriostatic, not bactericidal, meaning they don't kill the bacteria, they just stun it and move it to one other spot. Viruses similarly, so that's the important thing to understand. Symptoms different from the flu and COVID-19. So influenza is going to show up as body aches and fever. Usually you'll see body aches before the fever. With this, we often see the fever first and then the body aches. This one also has a dry cough. With the flu, there's often not a dry cough initially. So that's some of the difference. 3 of the patients that I thought had coronavirus because of their travel history actually had influenza. And so those are some things that we're seeing. Hopefully that helps clarify that a little bit with you there. I hope I'm answering questions and not making more questions and causing people to be more stressed out. So hopefully you're not stressed out about that. Ask again, said Tracy Silver. I'm not sure what we want me to ask again. Eat your bacon. Yes, Linda, eat your bacon. Don't eat the bread. Leave off the potatoes and the hash browns and eat your bacon. Lots of water, lots of salt. You use your salt. Pink Himalayan salt, Redmond salt. These are great salts to replace the electrolytes. You are very welcome, Jean. Hugs to you too. My mother was a hamster and my father smelled of elderberries. Not very often did she smell of elderberries, to be frank, yes. Or did he smell of elderberries? But and my mother was not necessarily a hamster. But I do know the speed of a south-flying sparrow carrying 2 coconuts. All right, let's see here. Perfect, said Candace. Thank you. You guys are very welcome. Mark, I'm going to go check your labs for you to make sure that you're not freaking out. All right. Is eating liver and organs as good as a multivitamin? You know, Karen, the amazing thing is that your organ meats contain more vitamins than regular proteins and fats. So absolutely, organ meats are beneficial in regards to providing adequate vitamins. And so back before that we had invented vitamins, when we ate organ meats and we ate the entire animal or used the entire animal when we were in the olden days, I guess you could call it, they did get a lot of their vitamin supplementation that way. All right, you're very welcome for the information. Fever for 9 days, but not over 104. Typical flu symptoms, just stayed home, waited out, or try to find out a testing center. Well, Catherine, that depends on whether, if you've had a fever and you're not getting better, my suggestion is talk with your doctor. Typical flu-like symptoms, it could be the flu. If you're improving and things seem to be getting better, I would probably tell my patients, hang out at home and don't worry too much about it. If the fever's getting worse, if you start to get short of breath, wheeze, you're getting worsening cough, and there was any question about exposures to someone who has this virus, I'd absolutely get tested. Let's see. I'm 71 and did not know until today that you are elderly. Susan, in your case, you're probably not elderly, so don't worry about it. I have the Tdap today. My daughter's pregnant due to 4 weeks. Have rheumatoid arthritis and fibromyalgia, afraid to get sick. Lupe, you're one that doesn't want to get sick. You don't want to get sick. Now, amazingly, if you have rheumatoid arthritis and you're being treated with Plaquenil, you're probably safer than many of us based on the data we just got yesterday. So that Plaquenil or that chloroquine, which we use to treat rheumatoid arthritis, often can be the treatment for coronavirus. And that's what I talked about earlier today, if you didn't see that. How about silver? Are you referring to Centrum Silver? Don't tell anyone, but I think Centrum Silver is worthless. Absolutely worthless. It's impossible to put in Centrum Silver all the things they claim are on that bottle. Absolutely, physically impossible. All right, let's see. There's any other questions here? You will see me on March 30th, says Vicky. Okay, well, exciting. I look forward to seeing you. All right, I think that's all of them. So you guys, I am going to sign off here since it's been about 20 minutes. Maybe longer. Actually, it's been 33 minutes. We've been rolling for 33 minutes. If there's no other burning questions, okay, let's see. I use cod liver oil. Tastes nasty, but I like what's in it. Does it help? General health, yes, it helps. Cod liver oil is omega-3, and it's omega-3 fatty acids, and they actually help with cholesterol levels and general help. Is it going to help with this virus? Probably not. Is it going to change that? It's going to keep you healthier. So I should say in a roundabout way, yes. But directly, no. Should I limit protein on a carnivore diet for blood glucose? Karen, if your blood sugar is running really high with the amount of protein you're eating, with my patients who are significantly insulin resistant still, I moderate their protein. I don't have them do high amounts. I do have them do moderate protein and more fat. And as they become less and less insulin resistant, we actually decrease the fat and increase the protein. They're still doing high fat, but we shifted a little bit. And I find that that's really the big key for both weight reduction and for modulating that insulin resistance. It takes about 18 to 24 months to truly heal insulin resistance. And so we start with a high fat, moderate protein, low carb diet. And then as they improve, we shift that to, we bring the protein up and the fat down a little bit in that regard. All right, let's see here. I hope that answers lots of those questions. Prednisone and methotrexate. So Lupe, then you want to be careful because you could be you are immunocompromised with the prednisone and the methotrexate. You want to, there's no study on methotrexate, but those two medicines can suppress some of your white cell count. So you want to be real careful with exposures. Or anyone who is using prednisone or methotrexate, I would be real careful with any exposures. You're one that I would truly quarantine. Amy said hers are made of brandy. I'm not quite sure what that means, Amy, but it sounds yummy. All right. I think that was all of them. All right. Hello, Elaine and Anne. Thank you. You guys are very welcome thanks for joining on. I hope this is helpful and hope it gives you some insight, gives you some solid knowledge, and helps take away some of that fear, because that's the last thing you need to do. If you're afraid and you're stressed out, that actually lowers your immune system. So we don't want you to be stressed out. We don't want you to be afraid. We want you to be wise and just realize that in all of life, all of us have challenges. Life is the only thing consistent in life is change. And you have to recognize that there's going to be trials and struggles that all of us are going to go through life, and this is one of ours. Somebody asked me, why do we have to stay home? I said, well, our grandparents had to go to war and fight in battles across the country. We have to fight Netflix on the couch. So this is one of those things that we have to struggle with. So let's see. I'm not even sure what the word is. Prednisone is compromised. Oh, prednisone. Prednisone is a steroid. Prednisone is used to decrease inflammation, but prednisone also diminishes immunity at the same time. So if you're on prednisone every day, that suppresses your immune system. So yes, it does suppress. Prednisone is the name of the drug. It's a steroid, and it suppresses your immunity, to answer that question. All right, guys, I'm going to sign off. My family's giggling and having lots of fun in the background. I'm sure you can hear them laugh and giggle. So I'm going to go join them and laugh and giggle some more, so we're not stressed. Read some funny memes, and that's really why I keep popping up these stupid memes, is because it makes me laugh. I know it makes other people laugh, and that takes a little bit of the edge off of it, so you're not feeling so stressed. I've had 3 or 4 people just chew me out because you're making fun of this terrible time. No, this is how I deal with stress. I make jokes about it, and I'm sarcastic, and I'm obnoxious. So if it offends you, then you need to go follow Dr. Barry. Did I say that out loud? Sorry, Dr. Barry. I'm teasing. You know that. All right. Good evening. We will talk to you later. And remember, keep the fat high, keep the carbs low, and pass the bacon. And go check out my website, darkmuscles.com. I wrote about all this on my website too. So go check it out, darkmuscles.com. Check out my YouTube page, where this will go to in an hour once I upload it to YouTube. So take care, guys. Have a good evening. Good night.